When your baby starts to crawl, they can bump their head on furniture or other objects, and falls are common. Most of the time the injury will be minor and they might not even cry, but sometimes a bump to the head can be more serious. If your baby has had a minor head injury, they may have a bump or bruise to the head and a wound, but they are still able to respond normally. If you think your baby has a minor head injury, sit them on your lap and hold something cold against the injury to help the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. Do this for a maximum of 10 minutes. While you do this, try and assess their level of response. Are their eyes open? Are they alert? Can they respond to you if you talk to them? If they only respond to voice, they're drowsy. Do they only respond if you flick the bottom of their foot? Do they only respond to pain? Are they unresponsive to any of the above? If you are worried because they're not alert or because the injury is serious, then call 999 or 112 for emergency help. If they have any wounds, treat them by applying direct pressure to the wound and keep checking their level of response. If they've had a serious knock to the head, they may have a serious head injury and show some of these signs. They may be drowsy, they may have a headache, they may be dizzy, they may vomit, they may suffer a seizure or fit, there may be fluid coming from their ears or nose, and they may be unresponsive. If you know that your baby's had a severe knock to the head, or you notice any of these signs or think they're getting worse, you should call 999 or 112 for emergency help and tell them that you suspect a serious head injury to a baby. While you're waiting for help to arrive, try to keep your baby still in case they've suffered a neck injury. Check your baby's breathing and prepare to start CPR if they stop breathing. So remember, for a minor bump to the head, ease the pain and swelling with something cold and check their level of response. Treat any wound or bleeding if necessary. If you're worried or think it's a serious head injury, call 999 or 112 and keep checking your baby's breathing. Prepare to start CPR if necessary. And that's how you treat a baby who's suffered a head injury. Thanks for watching. Help support St John Ambulance. Donate today.